Hi, this is Dr. J, and today we're going to be talking about diabetic retinal surgery. For patients that have severe diabetes and eye problems, very often they will develop what's called a traction retinal detachment. So, in very simple terms, I would like to demonstrate what goes on in a patient's eyes that needs diabetic retinal detachment surgery. So today we have a very simplistic form of demonstration. I was opening this table the other day and I thought that's exactly what happens when I'm operating on a diabetic. So I thought this would be a nice way to show patients and their families what to expect when they're preparing to go through this surgery. As you can see, this tissue, this padding tissue, is very attached with the tape, and beneath that is the table, which we'll pretend is the retina. So the goal is to get to the retina and expose the retina and allow it to open up without causing any holes or damage. But as you can see, this is very adherent in some places, and it's almost impossible to get rid of all this scar tissue without causing a hole. Then we need to deal with that afterwards. So the first thing that we need to do is make sure that we have all of the proper instruments so that we can perform any of the techniques that we need. We always need a good light source. Often, at the end of the case, we will use a laser to seal down the retina once we have it in place. We always need good cutting instruments so that we can cut through the scar tissue. And we need good forceps so that we can grab the tissue and put traction so that we can cut the tissue without cutting the retina. We also use manipulators that will allow us to gently elevate the tissue away from the retina without any sharp points that could damage the retina. So, let's get started. I will start, pretend that we've already entered the eye. I will be using a scissors and a forceps. We have a light source in the eye so that we can visualize well. And what I'm going to do is try and peel this tissue away. We use a two-handed technique that will allow us to separate this tissue. You can see how adherent it is. But if we're very patient, we're able to tease away this tissue into several layers. When we get to a spot where we've opened up a layer, we can actually cut it. So now that allows this tissue to open up even more. At this point, I may use two different forceps to gently separate the tissue. We always look around everywhere and find the most accessible spots. Go back in with the scissors. And as you can see, we're able to slowly, gently open up the tissue. All of this scar tissue is pulling on the retina and causing it to be wrinkled, just like this tissue is. So the goal is to eliminate all of the wrinkles so that the retina can settle down to its natural state against the back wall of the eye. As you can see, we're gently making progress. Cut through here. Voila. Let's find another site. And this tissue is very adherent. We try to find one little area of separation that we can now, sometimes you'll have tiny strands like this. We can now separate more and more of this tissue. And you can see how sometimes we're lucky and it'll peel off. We use counter traction to try and keep the tissue away from the retina. We can now cut this and open it up more. You can see that we're now freeing up a lot of this tissue, above the retina. Just have a few more areas here. There we go. It can be a very slow, tedious process, and what you're seeing us demonstrate in just a few minutes can sometimes take several hours. Sometimes once you start an area, it is easier to peel it, but we still have to be careful. We want to try and avoid tearing the retina if at all possible. And it's often hard to distinguish the scar tissue from the retina. And as you see, there's actually a hole here in the retina, which we'll need to deal with later. It was impossible to distinguish exactly where the retina was But we need to make sure we get the scar tissue away from that hole so that we'll be able to put it back in place once we're all finished. We have to remember where the hole is. It's not very large, but we have to make sure we can find it later. So now we're making progress. Voila, we have an opening toward the retina. We're able to continue working. Healing tissue. And there you have it. We have exposed the retina. We've located the retina. We can see that it's intact except for that one hole that we need to deal with. But now we can remove the rest of this peripheral scar tissue without worrying too much about damaging the retina. And hopefully this will allow the patient's vision to improve significantly once the healing process has completed itself. I hope this video has given you a little understanding of what actually goes on in a patient's eyes when they have surgery for a proliferative diabetic traction retinal detachment. Thank you very much.